Hello, my name is Sushmita Karki. I'm about to give a presentation on the topic inadequate staffing and skill mix in nursing. Today I'm covering topics on introduction, significance, impacts, mitigating measures, nurses' role and boundaries, and aim relevant to this issue. Firstly, I'm going to start with the introduction. Skill mix is the amount of nurses in different levels and the level of qualifications, expertise, and experience to provide patient care. It is a modifiable aspect of the healthcare sector and is the quantity of registered nurses to total nursing staff, including registered nurses and nurse assistants. Nursing skill mix team in Australia is the combination of registered nurses, enrolled nurse, and nurse assistants. Additionally, inadequate staffing is lack of appropriate number of staff to complete allocated nursing tasks by maintaining patient safety and quality nursing care. Importance of this issue. This issue is important and needs to be discussed because there has been a consistent nursing staff shortages globally. The estimated nursing shortage in Australia is over 90,000 by 2025. In a study, one quarter of respondents seldom or were never able to complete their work satisfyingly due to staff shortage, and 30% of nursing staff in aged care sector reported of a poor skill mix. And about 55 to 98% of nurses reported at least one task undone with consistent patterns of unfinished care. Some impacts of the issue on patient safety. High number of staffing causes lower rates of falls and patient stay, whereas inadequate staffing caused high rates of medication errors and unfinished patient care. Furthermore, the most common factor that leads to medication error was reported to be fatigue and exhaustion due to inadequate staffing. Among all the factors, the result was 58.5% of errors caused due to occupational fatigue, 65.6% due to heavy workload, and 69.7% due to inadequate staffing. Additionally, turnover caused by inadequate staffing caused increased rate of infection, hospitalization stay, delirium, confusion, and pressure injury among patients. Next, its impacts on healthy environment. High patient loads was negatively affecting career satisfaction among registered nurses in a 2003 study. Furthermore, insufficient staffing in nursing homes resulted in highest job stressor among registered nurses and nurse assistants. Moreover, nurses reported of working short-staffed with an unsatisfactory skill mix, working overtime, and working with nurses from casual pool or agency staff during stressful times. This has impacted negatively on nurses' emotional and mental health and well-being due to increased levels of stress, burnout, feelings of having no control over their work, and having to stay back after the shift. What is currently being done? Recently, more number of hospitals have started to use cost-effective approach, which is internal float system instead of using agency nurses. About 88% of nurse respondents in 2013 study revealed that float system improved job satisfaction and helped nurses to enjoy independence. Secondly, New South Wales Health recruited additional staff according to Nurses and Midwives Award and maintained nurse retention by providing scholarships worth of $10,000 and spent $3 million and $14 million for nurses' professional development. Another strategy which is currently in use is the use of simulation, which provided hands on experience and motivated to work and maintain retention among ICU nurses. Lastly, technology is being currently used to monitor, manage, track, and communicate information to manage staffing and maintain cost effective workforce. In the USA, about two-thirds of hospitals have automated staffing and scheduling system. Significance of this topic. The rate of nursing turnover is more than 50% and has become a global issue. In New South Wales, nursing turnover is of 1 to 1.4% per month caused by churn among nurses to maintain staffing levels. This has been impacting negatively in skill mix and affecting patient care. Furthermore, with the estimated cost of high turnover in Australia being $16,634 per nurse in 2014, it is an expensive issue. Secondly, work intensification is another issue caused by nurses' inability to finish their tasks on time due to inadequate staffing. Thirdly, care rationing has become a major issue and it occurs when nurses miss or delay prioritized care due to inability to finish the task on time. It causes failures among nurses, clinical decline among elderly patients due to insufficient time and inadequate staffing. Some effective leadership skills to resolve this issue. One potential reason of inadequate staffing is nurses' inability to report issues regarding workload to the management due to fear of losing their job. Hence, effective leadership helps to resolve this issue by involving workers in decision making by promoting autonomy among nurses. Furthermore, ensuring staff nurses take their breaks is one way of reducing stress and burnout among nurses. Moreover, nurses reported that a unit manager who is able to positively control the stress was able to calm everybody down during stressful situations. Hence, ability to manage stress and control work activities in the ward even during staff shortage is another example of effective leadership. Furthermore, the involvement of nurse leaders providing support, trainings, encouraging nurses to return back, working on goal development, skills assessment is a way of maintaining proper nursing workforce. Leaders understanding cross-generational workforce, enabling open communication, providing mentorship to young nurses is an example of effective leadership resolving this issue. A new graduate nurse's responsibility to resolve this issue. A new graduate nurse can demonstrate some above mentioned leadership skills by voicing and reporting workload issues to maintain patient safety. This can be done by maintaining collaborative workplace, helping one another, maintaining open communication and mutual trust with fellow nurses and management. Similarly, remaining positive and calm even during stressful situations and ensuring to take and give breaks can ensure collaborative environment. Registered nurses' professional boundaries. One of the professional standard and code of conduct of registered nurse is practicing nursing care in a safe and competent manner. This means nurses are responsible to safely delegate tasks without compromising patient safety. A 2009 report revealed that poor delegation from a registered nurse led to missed and omitted nursing care. Hence, new graduate nurses have a professional accountability to delegate and supervise tasks, and it helps by reducing the workload and helps to maintain collaborative working environment. Legal boundaries of registered nurse. At times, nurses end up not reporting regarding staffing issues due to fear of losing their job. However, nurses are bound by a legal standard to identify and report potential risk related issues where practice may be below the expected standards. Hence, reporting issues and consulting with managers falls on a nurse's legal responsibility to maintain patient safety. Furthermore, nurses have a professional obligation to advocate for improvements on improved ratios and patient safety for quality care. Hence, nurses are bound legally to advocate regarding legal mandated nursing hours or equivalent ratios within public health system nurses and midwives state award. Lastly, the first ethical code of nurses is to advocate for equity in resource allocation and social and economic resources. Hence, a new graduate nurse's ethical responsibility is to be able to support actions and interventions to meet the health and social needs of the public sector by advocating equitable allocations of resource. Why I chose this topic. Inadequate staffing and skill mix in nursing is a consistent global issue which has several negative impacts on patient safety as well as healthy work environment of nurses. Moreover, lots of research has been done in the past with study designs including retrospective large study design, narrative analysis of acute care literature, descriptive quality analysis of Australian nurses. However, these issues still exist and need stronger mitigating measures by future nurse leaders. How I communicated my presentation and why. The audiovisual presentation was used to convey my information about inadequate staffing and skill mix in nursing and how it impacts patient safety and healthy work environment. It is presented this way to engage nurses, nurse managers, and new graduate nurses about this topic. This topic is a current affair in healthcare, a global issue which can result in healthcare crisis soon if not managed or discussed appropriately. The aim of this presentation was to encourage nurse managers, leaders with effective strategies to approach this issue, maintain nurse retention, and to encourage new graduate nurses help resolve this issue. I would like to conclude my presentation. Thank you.